For me, I've been actually for this last month back in the hospitals. People may not know, but physios, obviously we deal with injuries and we deal with kind of post-operative work, but the other side of what we do is in acute care and in the hospital setting. So especially through kind of respiratory therapy. As you know, as I'm sure everyone knows by now, but COVID-19 is actually a virus that primarily attacks the lungs, and it gives people, or makes it very difficult for people to breathe if they're in that kind of unfortunate small percentage of people that get quite unwell with this virus. And I've been over in Ealing Hospital working in the ITU and the high dependency unit there with the physio team. And the physio kind of has two roles really in this regard. We work quite closely in the acute setting to help people with their oxygen requirements. So as they get more and more unwell, they require more oxygen, and we work with the doctors to help set how much oxygen they need. We help a lot with if they get to the point where their breathing becomes so difficult that they need support. They can either have non-invasive ventilation, which is essentially like an oxygen mask, which helps them to breathe with a bit of pressure. And if that doesn't work, then they can be stepped up to ITU, where they have mechanical ventilators which kind of take over the work of breathing, so somebody can rest and the doctors can get other areas of them as well as possible before taking them off the ventilators. So yeah, we help with that. We've been helping with the ventilator settings, the programs, also positioning of patients, obviously with our kind of knowledge of anatomy and the respiratory muscles. We found that positioning of the patient to ensure that they're able to breathe as easy as possible has been quite beneficial. You might have seen on the news, people have been proning patients, which is where you lie someone on the front. So we've been going through HDU and ITU and helping with that to get people's breathing as best as possible. Also, people can produce a lot of secretions at this time, especially on the later stage of the disease. So helping people to manage that with breathing exercises and things like that. So it's been a busy time, and I think although what we're seeing now is it's definitely quietening down in the hospitals, which is great. It's really nice to see. We're getting less admissions, especially in the hospital I'm working in. We're getting less people coming in, but what we're seeing now is obviously the after effects of the virus. And if somebody's been on a ventilator or required support with their breathing for quite a while, there's a number of things that after that they can struggle with. So there's something known as ventilator required weaknesses, which is essentially when your body becomes dependent on a machine to help you breathe. Your breathing muscles become quite weak, and obviously if you've been in bed for a week, 2 weeks, 3 weeks, even 4 weeks for some people, then you're going to start to get a lot of weakness elsewhere in the body, a lot of generalized weakness. So physiotherapy is going to have a big role to play, not only in the acute phases we're seeing at the moment, but even more so in the rehabilitative phase of these patients who have been unwell with COVID. So in the hospitals, we're starting to wean people off these breathing machines and then get them back on their feet, get them strengthening, get them working to try and get back to how they were before. This disease, this virus, really, recovery from it really is a marathon. It's not a sprint. I think people are, very, obviously it's only a small proportion of people that get to that point of needing ventilators, but when they eventually come off those ventilators, they're going to need a lot of support. And I think that's where physiotherapy in the future is going to have a huge role to play. So if you know anyone who's been unwell with it, if you've been unwell with it yourself, then don't be afraid to reach out to us, reach out to your physio. We're here to help. We're here to get you back on your feet. been a scary time for everyone, and I just hope that I think if we all pull together, we'll all be okay at the end of this. So yeah, stay at home, guys. Stay safe, look after the NHS. I hope everyone's fit and well, and I'm sure I'll be seeing you all soon. So take care.